Hello and welcome to HIMSS TV. I'm Susan Morse, Managing Editor of Healthcare Finance News. I am here today with Ian Slade. Ian is Chair of the HIMSS Chapter Advocacy Taskforce. He's also the former president of the Southern Chapter. Welcome, Ian.
Hey, good morning.
Good morning. What are the chapter's priorities related to the social determinants of health and health equity?
For the first question, in terms of chapter's priorities and what we're doing, two things that I want to say. First is we need to continue the conversation through the different events, even though the topics might not directly be linked towards social determinants of health or disparity. We include it in the topics that we cover. And as a matter of fact, in Southern California, we have an event coming up November 12th. And one of the topics directly talks about the social determinants of health. So there are direct and indirect conversations going on. But another aspect that I want to talk about is also representation. And this issue can be tackled when we have different folks bringing different voices that provide different lenses in looking at the different aspects that affect healthcare. That being, ethnicity, gender, economic background, age, all those things. So the more that the chapter represents the community it serves, the better we are to tackle these questions. So.
Yes, it involves whether you live in an urban or rural area. I understand that's a big factor. Age, and then there's health literacy. Can you talk about that?
Yeah, I actually have a really good example. I was talking to a friend of mine yesterday, and she was a surgical nurse by training, and she had multiple bouts of cancer, had a hip replacement, had multiple procedures done, and because she understood how to navigate the labyrinth of healthcare, she was able to get the treatment that she needed in a timely fashion. Now, not everyone is lucky enough to understand and to navigate healthcare and understand not just healthcare's different policies and systems, but also what is going on, right? What is going on with you, with your body, the treatment, what's coming up next. So that literacy there's a huge disparity in literacy in our community. So that's something that I want us to continue to talk about and see how we can improve that.
And at the macro level, I'm sure there's legislation. At the micro level,
sure.
What can be done? I understand that in California, they passed a perinatal bill. Can you talk about that and what it does?
Yes. Let me look at my notes here. So we passed Senate Bill, let me get it right, 464, which is the California Dignity in Pregnancy and Childbirth Act, basically providing training to healthcare providers to make sure that we track this data in terms of maternal mortality and also help improve the treatment that we give to our maternal patients. So,
yeah, and are you aware of other legislative efforts or other policy measures that would help?
Yeah, so a lot of the telehealth measures, going back to what you mentioned earlier, bridging that gap between the urban and rural areas, right? So especially now with COVID, the ability to meet up with your physician is definitely hampered by distance and obviously COVID. So a lot of the telehealth measures help bridge that gap. And we have a couple of those here in California and throughout the country, to be honest. A lot of telehealth bills are being passed and looked at right now.
Is this because of COVID? Do you think COVID has spurred this push towards health equity? I keep hearing how it's bringing up racial disparities. I mean, please, let's see some silver lining to COVID-19 since it's so devastating. But I'm wondering how COVID has affected people's awareness and what's happening.
Sure. Here in California, for UCLA, for example, they've had probably hundreds of telehealth visits pre-COVID, and right after COVID, that number shot up to thousands upon thousands of visits. So the nice thing about, not nice, I shouldn't say, necessity is the mother of invention, right? And in this situation we find ourselves in, we are pushed to figure out new ways of coping. And it just so happened that COVID was the catalyst. So there's that silver lining.
Yeah. HIMSS, of course, is doing work in this area, and I'm wondering how the chapters can work with HIMSS as a whole to sort of push the needle forward.
Sure. So there's a lot of private-public partnerships that can be done. Here in California, we're really pushing for partnerships with other organizations that have a different focus in healthcare, but nonetheless, we're trying to push healthcare as a whole, and also the private partnerships with organizations, and not just healthcare in particular, but organizations that can help, for example, pharmaceutical companies, that can really help improve the quality of care. And also, we're also partnering with a lot of the legislators in terms of informing them of what's going on in the communities, and for them to hear it from people in the front line. So again, going back to my initial statement, it's all about representation and communication. We need to continue the conversation. And I'm hoping that, folks listening to this can also continue the conversation with their family, friends, and coworkers. So,
yeah, I was going to ask about that. What do you recommend to keep that going? And in particular for HIMSS chapters that maybe want to learn from what you've done in Southern California, do you have any recommendations?
Sure. Reach out. So they can definitely reach out to me via email. We can provide that information in the notes here. But we do have a lot of events. As you mentioned earlier, I'm the national chair for the Chapter Advocacy Taskforce. We have those calls every month. So if you're part of HIMSS Chapter, please feel free to volunteer to become an advocate. And we have multiple avenues to continue this conversation. And also reach out to your chapter president. President can reach out to me, and we'll have speakers talk about this. As you can see, this is something that I'm really passionate about. So I'd love to get the opportunity to talk more about it.
Before we close, I want to ask you about resources for people who need it, the people who may be wanting to find out about housing, about other social determinants of health issues. Is there some sort of clearinghouse or some sort of way to get information? And what can HIMSS chapters do to get that information to people so when they go online to look up, where can I go from help? What can they find?
We do have some information. You can navigate on the HIMSS website. We can put the link below as well. But if you look at CMS, they have if you just do a search CMS and social determinants, they have a lot of great articles, and those are things I've been looking at in preparation for this as well. Surprisingly, actually, Cigna has a lot of good information about this, and they looked at it more from an economic standpoint. So a lot of good materials, just do a basic search. But again, I'd like to encourage people to reach out so we can have a conversation, because information only goes so far. And unless you can put a name, a face, a story to the numbers and facts and figures, it doesn't really resonate. So we would love to put a face to what's going on here. So please reach out so we can have the conversation.
Well, thank you, Ian. It's been a pleasure speaking with you.
Oh, it's been a pleasure.